Well, good afternoon, everyone. As well as the Minister for Health and Social Care, I'm really delighted to be joined by Dr. Rizwan Khan, our consultant microbiologist. Now, remember Dr. Khan's last appearance at our press conference, and I've been looking forward to his update today. But first and foremost, I will ask the Minister to go through today's statistics with you. David.
Thank you, Chief Minister. The total number of tests undertaken now stands at 3,401. The total number of completed tests is 3,359, meaning we are outstanding 42 test results back. The total confirmed cases stands at 325, which means there has been 4 new cases since yesterday. And it is also my sad duty to announce another death, this time within Nobles Hospital. Once again, this disease has struck at the very heart of our close community, taking another person from us and leaving family and friends behind to mourn their passing. I offer my heartfelt condolences to all their family and friends at this dreadful time.
Thank you very much, David. On behalf of the Council of Ministers, all in Tynwald, I pass on my condolences to the family of our tragic death today. Thank you. And thank you very much, David, for the update. Now, I hope you all had a good and restful weekend. I hope you were able to enjoy some of the sunshine with members of your household. Thank you to those of you who have ensured that social distancing measures were respected across the island. This will be the best thing we can do for the foreseeable future. The Chief Constable has reported this morning that compliance levels across the island have been broadly good, but there continue to be reports of people not respecting the rules around gathering and social distancing. Now, I know that these measures in place are tough on many people, and I know that a quick look at the daily statistics might suggest that we are out of the woods and there is no longer a need to respect the rules. Nothing could be further from the truth. Yes, we are cautiously optimistic about the situation, but we are where we are because all of you have been respecting the rules. If we trip up now, we could ruin all the hard work and the sacrifices we have made. We are looking every day at what we can do to make this easier, but people bending or breaking the rules will only make it harder for us to have confidence about the next steps. There is sadly still a hardcore group of people who are deliberately breaking the rules, and the law and prosecutions are still taking place. Today we published an important document. It is called Our Medium-Term Approach to COVID-19. Now, it's maybe not the snappiest title. I like to think of it as a roadmap for the coming months. It outlines the second stage in our response. The first, of course, was the introduction of stay-at-home and the measures we brought in to protect our island community. The document does look at this first stage. It tells you what we, as an island, have done and achieved so far, the journey we have taken together so far. It shows the significant impact that together we have all had in the first stage. You have heard me talking about this a lot of times. The most important thing was we built capacity in our health sector, but we have done a lot besides. We have brought in legislation that we needed. We have strengthened our infrastructure to protect us. We have put in place schemes to support businesses and workers. In turn, you have done your bit, sticking to the rules and pushing the curve right down. We asked you to suppress it, and you did it. But more importantly, the document we have published today describes the journey ahead of us. It gives you our best assessment of the decisions that we think we will need to be addressing in the coming months. We wanted to give you as much transparency as possible on that. It tells you how we have broken down what is an incredibly complex picture into manageable areas. These areas are based around our needs in health, society, and the economy. This is the balance we need to work to achieve as we go forward. It tells you how we will make the decisions and what some of our limitations are. As you will see, there are no firm dates. As I said, this is a roadmap. It sets out where we are and where we want to go. But we are unlikely to be able to get there as the crow flies. Just because two elements are both in our level 2, it does not mean that they will necessarily happen at the same time. We will be driven by advice from our clinical leadership team. We will make decisions in the best interests of the island. We will make changes when we think the moment is right. We cannot be driven by dates in the diary. There may be delays along the way. We may need to pause. We may need to vary our route. We may even need to reverse and take a different route altogether. I hope it won't come to this, but I do need to be clear that if we see significant spikes in the spread of the virus, we may need to consider this. As well as telling you about the achievements so far and showing you how we will move forward, it also tells you what we will regularly review, our plan, and we will share our thinking with you as soon and as clearly as possible. As I mentioned last week, the next fundamental review point for the Council of Ministers will be this Thursday. We will be considering then what we may or may not be able to do next, and I will brief you on the outcome on Thursday evening. Now, I often talk about basing our decision making on the best possible data. One key source of data is from our testing. Establishing the on-island testing facility has clearly been a great achievement and has allowed us to manage our own processes without having to rely on our friends across in Manchester. Our facility has a capacity of around 200 tests per day, and I know that people have asked why we are not using that full capacity. The Health and Social Care Minister has told you that we have been gearing up to a new approach on testing. The Council of Ministers approved this approach at its meeting on Saturday, and I would like to invite the Minister and Dr. Khan to tell you more about that. Thank you, David.
Thank you, Chief Minister. Before I bring Dr. Khan in to tell you more about the testing strategy and how we're moving forward with our testing, I'm delighted the Council of Ministers approved the testing strategy at their meeting on Saturday. We've spoken before about the need to ensure that any testing we do is targeted, not just testing for testing's sake, but ensure that it actually provides us with something useful, focusing in on those areas which we believe will have the greatest impact in our fight against this dreadful disease, and using our expanded resources wisely. That is what this testing strategy does, and it also lays out different plans as to things we may look at different stages. And with that, I would now like to invite in our consultant microbiologist, Dr. Khan.
Good afternoon, everybody. I hope you don't mind me using my little gel first. Right. Thank you, Chief Minister and Minister Ashford, for inviting me to today's briefing to share the COVID-19 testing strategy. Since the first case on the island over 6 weeks ago, this is an evolving strategy revisited with every piece of good evidence that becomes available to us. I will begin by sharing a timeline of where we started, where we are today, followed by an overview of the test itself. At the end, I'll touch on the next steps of COVID-19 testing on the island. The testing criteria are based on Public Health England's case definitions that continue to evolve with spread of COVID-19. Initially, the case definition was acute respiratory infection of any degree of severity and a recent history of travel to specified countries. On 13th March, the travel component of this case definition was removed, focusing instead on symptoms of new continuous cough and/or high temperature only. In the beginning, all tests were referred to Manchester Public Health Laboratory for reverse transcriptase polymerase chain reaction, also called RT-PCR, with a turnaround time ranging from 48 to 72 hours, depending upon Manchester's capacity. Samples were collected by dedicated swabbing teams who visited people at their homes and hospitals' emergency department. On 20th of March, the drive-through at the grandstand became operational, along with COVID 111 helpline and the opening of CAT2, COVID Assessment and Therapy Unit. At this point, the swabbing teams were collecting specimens from home, ED, CAT2, and the grandstand. We were sending over 100 swabs a day, 7 days a week, to Manchester. On 6th April, we extended testing to all non-COVID hospital admissions. All patients presenting to the hospital for an overnight stay would be tested, and that included maternity admissions, pediatric admissions, elective and emergency surgical admissions. England has only started testing these patient types from last week. The first positive case in a nursing home was confirmed on 12th of April. We responded by testing all symptomatic residents and members of staff as part of the outbreak management plan. It has now been agreed to test all residents and staff as a part of overall response when one or more confirmed positive cases are reported at a residential home. On 19th of April, a plan for pre-discharge COVID testing was discussed following the recent intake of residential home patients at the Newlands ward. I'm pleased to say that this plan is now in action. For essential workers returning to work, we have developed 2 test pathways. The first pathway responds to symptomatic essential worker, and the second pathway responds to symptomatic household contact. Any symptomatic essential worker is offered a test through COVID 111, and the relevant pathway is followed. Now coming on to the test itself. I'm very lucky to have a committed, motivated, and a hard-working laboratory team who have worked tirelessly day and night to develop on-island testing. We are following a 2-pronged approach to ensure high-quality testing. The first is the development of high-throughput RT-PCR using the same machine used by Manchester Public Health Laboratory. This platform currently has capacity to perform up to 200 tests a day, with a provision to double the numbers of tests if required. Prior to the launch of this method on 20th of April, we ran 172 tests in parallel with Manchester Public Health Laboratory with 99% concordance. For the second method, we have procured 2 rapid CAFED Gene Expert cartridge-based machines. These machines have the capacity to return urgent results in 60 minutes with a maximum of 40 tests per day. To be able to perform these tests, we are awaiting test cartridges from the UK. Now, where do we see ourselves in future? We have explored several avenues to enhance testing in the future. For example, screening of asymptomatic essential workers and shifting to wider community testing. We feel there is currently insufficient evidence and too many uncertainties to implement these approaches at this stage. Due to high demand of testing resources around the world, we are taking a pragmatic approach, ensuring these resources fit within the framework of our testing strategy. We are continuously monitoring all avenues of further testing and will act as soon as stronger evidence becomes available. More long-term, we have expressed our interest to participate in COVID-19 study for UK overseas territories, supported by Public Health England. This will give us a better understanding of the virus and its likely route of transmission within the communities. We look forward to hearing further about the practicalities for taking this forward. While testing is integral to fighting COVID-19, continuing to follow protocols to minimize the spread of the virus is just as important. I encourage you all to maintain hand hygiene, continue practicing social distancing, and where necessary, self-isolation. Thank you.
And can I thank both of you, and Dr. Khan, please do take my best wishes to all your colleagues working on testing. We're all very proud of what you have achieved. Before I take questions, I wanted to address 2 points about which members of the public have been in touch with us about. The first is sport and recreation, and I've been pleased at the comments we have received from so many of you around our decision to allow golf and fishing to resume, albeit with restrictions in place. Colleagues at the Department of the Department of Education, Sport and Culture are working with other sporting bodies to look at what can be done to safely reintroduce a number of different sports. Together they are developing papers on which we will be asking for clinical advice and the views before the Council of Ministers discusses them. We will let you know as soon as we have news. And thank you to the sporting associations for their engagement. Secondly is around family contact, and I know how important this is to people. It pains me that I have not been able to sit down and have a good chat with my own parents and other close relatives for some time now. A lot of you have told us that this is the single thing that would make the current restrictions more bearable. And some of you have told us that this is the toughest thing for your own mental health, to not be able to see your loved ones. Now, we are not quite at the point where we are able to lift the restrictions on seeing other people from other households. This has been such an important contribution to stopping the spread of the virus. But, as I promised you, I have asked our clinicians what might be possible while still being safe. They have now come back to me, and I would like to read from their reply. The current downward trend in daily positive COVID-19 cases shows that the measures introduced by the government have been successful in suppressing spread of the coronavirus. Despite the fall in the number of positive COVID-19 cases, we know that the virus is still circulating in our community. We still need to protect those most at risk of serious COVID-19 from catching the virus. Older people over the age of 70 continue to be at significant risk of severe disease if they get COVID-19. Whether they are living in the community or in residential care, older people are still advised to self-isolate as far as possible to avoid coming into contact with the virus. It is still possible to have a face-to-face conversation with your loved one, so long as you do not enter their home and can maintain a 2-metre distance from them. You can do this, for example, by visiting at a pre-arranged time and talking to them whilst they are at a window or doorstep and you are 2 metres away in the garden or in the street. Now, I'm really grateful to our clinicians for their clarification on this. I know that this may not work for everyone, especially if people live on the upper floor flat, for example. And of course, the restrictions in place for visiting nursing homes are important to be maintained for the time being. But I hope this clarification will help some see their loved ones. I know I will be looking forward to taking a deck chair and setting up in my parents' garden to chat with them this weekend. And if you are alone, maybe arrange a socially distanced and safe deck chair meeting with a friend or a neighbour. Let's support each other's well-being. I will now take questions. And the first to go I have is Tim Glover from Manx Radio. Tim.
Best of night, Chief Minister, and obviously thoughts with the family affected once again by this terrible virus. My 2 questions are for Dr. Khan, but before I do that, is it possible to confirm whether the sad death that we've had is connected with the nursing home again?
I don't think I'm able to comment on this. I'll just check with the Health Minister to see if he's able to confirm or whether it's too soon to share this information. I'll bring in David.
I can confirm there isn't a link with Abbotswood in relation to the death in Nobles.
Thank you.
Okay, if I bring in Dr. Khan now, would you like to come in for the 2 questions?
Dr. Khan, thank you very much indeed for the very concise and interesting summation you gave of the testing regime. Is there evidence that the COVID-19 virus is evolving and mutating? Because we've heard reports of rashes, we've heard reports of COVID-19 fetus, it's been put. Is there any medical evidence out there?
Thank you. As you know, this is a very new virus, a novel virus. Things are changing every day, every hour of the day. And when we look at the literature, there is some reporting on changing of virus, mutation of the virus in different parts of the world. For example, in Asia and Southeast Asia. I think at this point in time, we cannot, categorically say that the virus has mutated. But as I say, in literature, there has been some evidence, I can't say how strong the evidence is.
And just with your team at the laboratory, was there a degree of retraining in order to run it as a test centre?
Can you repeat the question? Is it about the testing that we have set up here?
Yes, but it's also, you're all very expert people, but was there a degree that you needed to retrain, to restructure in order to be able to run the test centre?
We are blessed with a very intelligent, hardworking team who are expert in their own fields. And they are all clinical specialists, microbiologists, and the basic science is the same. So it's just a matter of putting things together to develop a test. That's what we have done.
Thank you.
Thank you.
Thank you very much, Tim. And next we have Rob from 3FM, Rob Pritchard.
Good afternoon, Chief Minister, and
Hi, Rob.
also our sincerest condolences to the family and friends of the person who's passed in the last 24 hours. My first question is to either the Health Minister or Dr. Carr, please. It's in relation to, Dr. Carr mentioned there, I believe the term was gene cartridge testing coming forward at some point. That can be done in 60 seconds, whereas a standard test can take 24 hours. I just wonder how those tests, how people are going to be prioritised for those quicker tests over the standard ones.
Okay, I'll bring them in. Dr. Khan.
Thank you. Right, this CAFED expert cartridge-based system is it's 60 minutes, not 60 seconds. Apologies if I said 60 seconds. Right, 60 minutes, and this is gives you an urgent result. It is considered urgent. We are still waiting for the cartridges to be sent from the UK. As you would understand, that this is the system most of the NHS labs are using. So the provision of cartridges is centrally controlled and is on allocation. So our allocation is hopefully due by middle of this month. Now, once these cartridges are with us and we are in a position to use them, we'll set up a protocol. Where do we use them? Do we need to use them in our critical care situations? Do we need to use them in our ED situations, or where an urgent result is required? Say, for example, in case of a healthcare worker who is essential to the services and wants to come back. So this is work in progress. Thank you.
Thank you. My second question is for the Health Minister, please.
Good afternoon.
Good afternoon, Minister. Just with regards to a couple of comments you made late last week You mentioned that there were potential changes being looked at to the quarantine system at the Comus Hotel. Do we know when a decision will be made on that?
Well, as I said, it was a question that came off the back of what the Chief Minister had stated last week in evidence on Friday. The system is still being worked up. As I made quite clear when I did the press briefing, I'm not going to start announcing policies on the hoof from the podium, but there is now there will be the ability for residents to self-isolate going forward, but we will come out with the full policy and how they have to comply with that when it's ready to do so, which hopefully will be sometime later this week.
Thank you very much.
Okay, thank you very much, Rob. We now move on to Simon Richardson from Business 365. Simon.
Good afternoon, Chief Minister, and may I firstly echo the earlier sentiments in relation to that tragic death at Nobles. Chief Minister, you've spoken before of the very difficult balancing act the government faces in both dealing with the virus itself and the effects on people of enforcing the antivirus measures. There are growing signs, certainly in the UK and potentially, I suppose, here, that people are suffering high levels of anxiety at present. Could this possibly, do you think, lead to the authorities, particularly in the UK, relaxing measures too early and risking a second wave of the virus?
Well, that's certainly a concern that all of us have. When we make our decisions, we look at the social values, the health values and the economic values, and those three areas we then give us an answer on how we're moving forward. So if we look at things like the health side of things, we look at capacity in the hospital, the number of cases, the number of people using our 111 line. From a social point of view, we look at updates from the police example to see the number of maybe arrests they've had to make or calls they're getting on mental health. And we have our own sort of data going forward too. And then we need to look at the number of businesses that are saying, look, we cannot survive anymore if we're shut down. And I've said time and time again, my number one concern, and that of the Council of Ministers, is the safety and health of the people of this Isle of Man. But we have to be careful that we don't have a Pyrrhic victory where we beat the illness, but our economy and the mental health of our people is destroyed. So it is a great concern. We come up with Manx solutions for Manx problems. Yes, we look at evidence from a number of countries across the world, not just the United Kingdom, but everything that myself and the Council of Ministers does is always, what is the situation on the Isle of Man? What is best for the people of the Isle of Man? And what is our solution to the Manx problems that we have? So it's a finely balanced decision sometimes, but we are doing our best, and I think the evidence so far supports the decisions. But of course, we always take little steps and then review what we've done. And your second question, Simon?
Thanks. Yeah, thank you. My second question is a financial one. As the crisis develops and timescales for the different stages of recovery begin to evolve, is it possible to put an approximate figure on the eventual cost of the crisis to the island? Do you have a kind of best case and worst case scenarios in mind?
Well, I know you've got the honour of the Minister for Enterprise coming tomorrow to give you a discussion on the various cases, the financial support that we're giving to either business or individuals. I'm sure he'll be better placed to give an update. But yeah, we are looking at a downturn in our economy, our monthly income, which is, we're sort of working on a figure of 60-70 million pounds a month. And then you've got the benefits that we're paying out under the 6 schemes at this moment in time. So we regularly in the Council of Ministers review the data of what's going out, what isn't coming in. And we are in the fortunate position that for the last 8.5 years I've been working with others to get our economy balanced. But whilst we have a balanced economy, if you're spending tens, if not 100 million a month, then it's not going to be long before your reserves run out. But we're certainly okay for this year. But hopefully, if everything goes according to plan and we keep the curve down, keep the curve suppressed, then we will be able to make the changes, but only when they're safe. So the first thing that drives all of us in the Council of Ministers is the health and safety of the residents of the Isle of Man. But obviously we do look at other measures. Thank you very much, Simon. Moving on now to Paul Moulton from MTTV. Paul.
Hello, Chief Minister. Hope you can hear me okay, because my link's been pretty bad, so you've been a bit hit and miss, so apologies if I've asked anything here that you've already done. First of all, though, could I have the Health Minister, because he was going to come back to me on answering a question I asked on Friday about the quality of tests. That's on that question. And while I've got the Health Minister, could you tell me how many hospital admissions, how many people on ventilators, and were those new ones, I know they're not in the nursing homes, but were they a cluster in their own, or were they random? Before the main bits.
Okay, so quite a few questions there, David.
Thank you, Chief Minister. You'll have to forgive me, Paul. I'll pick the ones off immediately I caught there, but you might have to repeat a couple of them.
Yes.
In terms of the accuracy of testing, I'll bring Dr. Khan in a minute, if I may, because he's probably a lot better placed to be able to comment on that than I am. But in terms of the test we are using, they are exceptionally accurate because what they look for is the virus within the body. They're swab tests. And so the accuracy, unless you're in the very, very early days of the virus, where there isn't much in the system, my understanding is they will pick it up other than in that period. In relation to the nursing home, you asked around, was it clustering?
Well, yeah, Tim already asked if it was nursing home related. You said it wasn't, but I'm trying to find out now if these new cases are related.
Oh, sorry, the 4 new cases I've declared today, then none of them are within the nursing home, but we believe there's one that may have an Abbotswood link, but none of the others are related. None of the others, so 3 others are not related to Abbotswood. But also, I need to clarify, they equally have no link to any of the industries that reopened recently either.
And the amount of hospital admissions and ventilators, please.
So hospital ventilators, I can actually tell you at the moment there is 0 people on a ventilator. And in terms of the actual hospital admissions, the current number of hospital admissions, including the 12 in Newlands, stands at 20.
Okay. Is Dr. Khan available?
And I'll bring Dr. Khan in to mention on the testing.
Dr. Khan, what it was, I think on Friday, I'm not sure you heard it, but somebody who had a test said that they were getting it from the front of the nose, and they seem to be people in the medical profession. They were surprised because it should have been, obviously, the swab is taken from the back of the nose, and therefore they were just being into question maybe the quality of some of the testing.
Right, thank you. We follow Public Health England guidance on the way we swab. There is what is called nasopharyngeal swab, which means you put in a swab that goes through the nose, back of the nose, and hits the throat, and that is considered to be a good specimen. Now, this swab is all right within hospital settings. You see, doing a good nasopharyngeal swab in setting outside the hospital, for example, grandstand, may not be easy. So Public Health England has recommended an alternative approach. So that is a single swab going through to the throat first, back of the throat, until you gag. It should be an eye-watering experience, not just a bit of a tickly nose or tickly throat thing. So once that swab comes out of the throat, the same swab goes into the nostril and goes in as deep as you can take it. Now that is the standard way of doing it, and we have done over 3,000 swabs so far. Our teams are very well trained, and we keep reminding them of the need for a good swab, good quality swab. Sometimes we do get an occasional feedback where it is not done as one would expect, and that we take it as an opportunity to remind our teams once again that these swabs need to be taken carefully and correctly. Thank you.
Thank you. And very quickly, my second question for the Chief Minister. With a 60-second test available, Chief Minister, the potential was you could maybe have held the classic TT, albeit with no visitors, and just get all the teams tested, or is that just too fanciful?
I think 60 second is fanciful because it was 60 minutes. Yes, I'm afraid that's too fanciful. So I think we'll swiftly move on from that one to Josh from ITV. Josh.
Thank you, Chief Minister. My question is either to yourself or the Health Minister. I just wanted to touch on something that is happening in Guernsey with their social bubble idea that they're going with at the moment, in that they're allowing a household to buddy up with another household to enable some much needed social interaction. I know you've said about meeting in the garden, but is this social bubble scheme something you are considering at some point, not necessarily a timeline or anything, just something you are looking at?
Yes, Josh, it is being looked at. Well, we're looking at a variety of measures. So some will never see the light of day because they're not deemed safe to go ahead. Obviously, Scotland, the UK have discussed bubbles of up to 10 people that can come into your family, etc. It's not something that we feel we're even close to at this moment in time. But can I just clarify, because the modern technology, I've already seen some of the comments from people. You can go into the garden to speak to a loved one. You can't, I'm not saying you can have a party there, and please don't abuse it. We're just trying to be helpful to give people advice that if you feel a loved one needs to have a visit from yourself, as long as you maintain the 2 metre distancing, or 6 foot, as they used to say in old money, then that's fine. But please don't abuse this. This is trying to be helpful for people who are isolated on their own, that maybe really benefit from seeing a loved one's face and having a chat for a while. It doesn't mean to say that you can then throw a party in the garden. It's purely there to grab a deck chair, have a chat with them from a distance, just boost their happiness and their mental attitude, really, on that one. That's what it's there for.
Okay, thank you. And my second question, we've seen over the weekend that the UK government is using the Isle of Wight as a test location to trial an app to aid the NHS. I appreciate the Isle of Man is its own jurisdiction, so it's a bit different. But has the UK government approached you and suggested trialling anything on the Isle of Man? And if they did in future, would it be something you'd be open to discuss?
I can confirm that at this moment in time, we've not been asked to do any trials on behalf of the UK government. Obviously, if it will help the people of the world and our close neighbours, and it doesn't have a detrimental effect to the people of the Isle of Man, then I'm always prepared to try any new technology that may help fight in the fight against this terrible virus. Thank you very much, Josh.
Thank you.
Okay, we now move on to Chris Cave from Energy FM. Chris.
Good afternoon, Chief Minister. It was interesting to read in the 27-page document published earlier today that you made a specific policy decision to move away from the Public Health England approach and instead take a more robust stance. Just how different are the two approaches, and will there come a point in future when we have to realign with Public Health England?
Well, I'm very clear that we took decisions that were right for the Isle of Man. We were in a totally different situation from the UK. We can close our borders. We don't have millions of people in small confined cities. So we were able to implement totally different procedures than the United Kingdom. Now, obviously, we, of course, and our public health team regularly have daily calls with the UK's public health team to get the latest thinking and advice, and if it's relevant for the Isle of Man, then of course we're going to accept it. We carried on doing our testing, we carried on doing our tracing. I think that was a massive success for the Isle of Man, and it's one of the reasons, one of the three key reasons, I think, why we've been able to flatten the curve as much as we did. The UK didn't, but again, it's all about different circumstances. So if something is right for the island and the UK are doing it, then of course we'll do it. But I genuinely believe that we come up with Manx solutions for Manx problems. Thank you, Chris.
Thank you. My connection hasn't been the best today, but I did think I heard Dr. Khan say before that all residents and workers in care homes were to be tested for coronavirus. Are there any considerations to expand this to cancer patients too? As I know there are many who suffer from it who are worried that they're 5 times more likely to contract coronavirus if they suffer from cancer. and they may live in households with also pregnant people as well.
Yeah, first and foremost, Chris, I think we need to point out the effects of the illness are five. I don't think it's 5 times more likely that you'll catch it. I think it's more 5 times the severity of the illness, because obviously your autoimmune system has been totally broken down when you're on chemotherapy drugs with cancer. So that's why we recommend people don't take their chemotherapy, because if you've got an autoimmune suppressant and you get COVID, then you're going to really be hit by this terrible illness. Now, of course, our medics are regularly looking at a number of issues, such as when do we restart our normal day-to-day procedures up at Nobles Hospital. So they're looking at data all the time, Chris, and we want to get back to as normal a world for the people of the Isle of Man as possible, but it has to be a safe place to do it, and we have to make sure that we have the capacity at Nobles so that if we do start doing various treatments again, then we've got the capacity to do that, should we see a slight increase again. And I'm sure that they will be regularly looking at cancer and whether we need to test. But as I say, anyone coming into the hospital is routinely tested for coronavirus. Thank you very much. Thank you very much, Chris. Okay, and now we move on to Mr. Alex Bell from BBC, who is looking very presentable today. I understand Alex shaved his head and raised £1,000 for the Isle of Man Solidarity Fund. I don't think I'd get much money if I was to shave my head, but well done, Alex.
I took inspiration from you, actually, Chief Minister. First question first. Obviously, we had the cancellation of the Festival of Motorcycling Manx Grand Prix confirmed today. What was behind that decision being arrived at today? Because it is another major government event which is cancelled for obvious reasons, but why was that announcement made today?
Well, I think first and foremost, we wanted to get it out as soon as possible. If we weren't going to do it, then we felt we owed it to the fans. We owed it to the people who organised it, because obviously a lot of money goes in preparation. If you're a fan, you're saving up to travel, to book the boat. If you're the organisers, you're training, you're putting out facilities. So I'm delighted that the Department for Enterprise worked with the Manx Motorcycle Club to work together to come up with this decision. Obviously, it's a tough decision. Personally, I am a big supporter of the both events on the island and the motorcycling calendar, but I think it was the right decision, and hopefully we'll bounce back next year and we'll have a good TT and a good Manx Grand Prix and TT Classic in 2021.
TT is a bit easier, I think you'll admit, to get back up and running because of the levels of corporate sponsorship and the generally better attendance and the more money that's spent at the event. But I know the motorcycling industry has been saying that these events have been suffering in their own ways in recent years. Do you think the Manx Grand Prix and Classic TT have got the mileage to continue next year, or could this be a hammer blow to their future viability?
No, I have every confidence that they will be there next year. Obviously, it's down to the hard-working people who marshal and the various clubs that help support the Manx Grand Prix. But I think, personally, it would be a tragedy if we were to lose it, because it's effectively a training ground for our future TT riders. And as someone who grew up at Bargarrow watching the old Castrol bikes coming around in the 70s, and it would be to miss the noise and the smell of the Castrol on the older bikes. That would personally be a tragedy for me. But no, I think they will be there. They'll be back next year, and we'll do our utmost to make sure it's a fantastic, weather permitting year.
Thank you very much, Chief
Alex.
Minister.
Okay, we now move on to Sam Turton from Isle of Man Newspapers. Sam.
Good afternoon, Chief Minister. As we've gone through the documents today, one thing that stands out quite a lot is the economic pressures on the islands. Things on page 7, it says about these are not quite clearly measures that can carry on long term. And just how great are the economic pressures on the island? Because it does actually make for quite grim reading as you go through it. It talks about unemployment still rising, for example, and the actual cost to the Treasury each month. How sustainable is this? And in terms of the island, what sort of, are we in a secure financial state?
Well, if you think of the Isle of Man compared with other countries, we don't have the debt that other countries have. Now, obviously, we've looked to set up a borrowing regime to enable the island to go forward, but we have our own reserves, which we're more than confident will last for the rest of the year and into next year. But we don't want to be in a position where possible, where I've mentioned this victory where we win, but we've decimated our reserves. And obviously, therefore, you take into account when you're looking at your stages and your next steps, first and foremost, capacity, but also how is the economy doing and how are the social implementations of people with mental health. So the last thing we want to do is keep restrictions too tight and see they're totally destroying certain businesses if we have the capacity and the cases are low. But we can't make big jumps because that could really damage the health side of things and the number of cases that we're getting. So it really is a fine balance, Sam, but I wanted to show the people of the Isle of Man by publishing this document. Obviously, we'll be debating it in Tynwald on Tuesday, but I wanted to show everyone all the various issues that the Council of Ministers look at when we make a decision. It's not easy, and we do our very best for the people of the Isle of Man.
And secondly, staying with the document, in Appendix 4, where we talk of stay safe to new normal, in terms of the borders, it's about residents and non-residents to quarantine when arriving on the island. We're just not entirely sure. That seems a bit different to what you said in the committee on Friday in terms of the difference between quarantine and self-isolation. Could that be more quarantine at home as opposed to, for example, at the Comus?
Yeah, well, obviously, we've had a paper. The Council of Ministers have approved to make changes, but they have to be worked up, and we hopefully will be able to give more notice, more information by the end of the week. But I think it's important to note that our borders will remain closed for quite some time. The UK does have too big a viral infection rate to open our borders, and it's only when we are convinced that the opening our borders, and it may be other countries first, that it's safe to do for the people of the Isle of Man. But that is some time away. But we need to look at, now we know where we are with the virus and where it is on the island and the numbers and the capacity we've got and the fact that we've built up our capacity, we can now look at making further changes that still protect the people of the Isle of Man, but make the repatriation, for want of a better word, of the people coming back to the Isle of Man as smooth as we possibly can, but without damaging or risking the safety of the vast majority of the people on the island. Okay, Sam. Thank you very much for your questions. And last but not least, we have Amanda Cashmore from Gef the Mongoose. Amanda.
Thank you very much, Chief Minister. Firstly, could we clarify a little bit on what you said before about people visiting people on their doorsteps? Is that starting immediately? Is it only for those who live alone? Does it include friends as well as family? Are numbers limited? And will you be publishing guidance on that?
Yeah, we'll happily put some guidance on our website, but it can start immediately, but it's for the visiting of friends. We're not restricting it to those who are living on their own, but if someone would appreciate a visit from a family member, you cannot go into the house. You must stay outside. We recommend that you ring that person up and agree a time. That's mutually convenient. You speak from outside the window from 2 metre distance or from the doorstep 2 metre distance, but it's there to try and enable people who are maybe social isolating on their own, who are lonely, who are stressed because they're not seeing the face of a loved one. So it's trying to help ease the pain and the problems that people are experiencing by being isolated, but we ask people not to abuse this. This doesn't mean to say you can have a party in your garden. It purely means that you can go and visit a loved one. If you want to bring a child, that's probably acceptable, but you cannot go into the house, and you must maintain the 2 metre distance. I have been inundated with emails from members of the people who've said, look, we're really, really stressed, we're lonely, please can you help? And they want us to move into the bubble phase. Now we think the bubble phase of maybe having 2, as if they've done in Guernsey, or 10 as is being muted in Scotland, but not actioned, I hasten to add. We've listened to that, and we've tried to come up with some sort of sensible compromise to help people, whilst maybe further down the line we have something similar to maybe what Guernsey have done, but we're not ready to do that yet. So I hope I've explained it as clearly as I can, Amanda.
Thank you. And secondly, the second phase of the document published today includes restaurants opening up while adhering to strict social distancing to keep customers safe. Do you recognise that for many, cutting the number of customers will mean businesses will run at a loss? And are you looking for alternative help, such as providing larger spaces at reduced rent to help keep doors open to these sort of hospitality businesses?
Well, obviously, if a strong case is made, we'll obviously look into it. But I think there are quite a few restaurants where they can sensibly maintain the social distancing. Obviously, that you won't be able to go up to the bar yourself and get a drink. Everything will be brought to you at your table. And really, it's up to the restaurant trade to work with government with ideas. But we are that's a different stage from where we currently are, and it will be all on data and evidence based as to how the businesses can be maintained. I know there are some that are big enough they can do this quite comfortably. Some of the smaller cafes, restaurants will really struggle, whether they'll only have a severely reduced number. But it's a step in the right direction. We are helping those businesses anyway, as long as they're up to date with their tax and national insurance. And if they cannot open up because of those restrictions, then they will be and still enabled to claim the support that they're getting. So it's just trying to be as helpful as possible. We're never going to get to utopia on this, but we're doing our best to look at ways of how in the future we can allow our restaurants, cafes to open. And I know this is a similar problem I was discussing last week with the chief ministers of Jersey and Guernsey. Thank you very much, Amanda. Okay, I think that's us. But thank you. But before I go, I'd like to give some shout outs. The first one is to the Rock Project, which has helped to produce so many good musicians over the years and continues to nurture talent and encourage young people across the island. Now, when the schools closed, clubs had to stop too. But within a fortnight, the team had set up lessons on Zoom, helping everyone involved keep on rocking. Encouragingly, creativity is also the subject of our second shout out today, which goes to Ricky, Callum, and the team at Quine and Cubbon Printers in Port St Mary. They've come in for praise from local residents after delivering lockdown drawing pads free of charge to children in Port Erin and Port St Mary. And last but not least, a special mention is being given to Housing Matters and everyone involved with GRI, particular Erica Irwin and the staff there. The night shelter is invaluable for many vulnerable people and provides a safe, caring environment. Thank you everyone for tuning in. Tomorrow the Minister for Enterprise will be here to update you on the work to support our businesses and workers. All being well, I should be back on Wednesday with a focus on mental health. Until then, please stay safe, make the right decisions for you, for your families and for our island. Thank you very much.